We have promised to get our Polis Promises graphic updated with one of those snappy TV jingles. But the governor keeps moving the ball on his campaign promises before we can get that done. So you are left with me introducing Polis Promises today on health care, where he signed an executive order.
Unless we make progress on saving people money on prescription drugs, unless we make progress on addressing some of the pricing disparities in western Colorado and preventing some of those high-cost cases for bringing up rates, we're never going to be able to expand coverage and get to universal care.
And with that, the governor put the healthcare industry's money where his mouth is. Through an executive order, Polis officially started a state office with a deliberately catchy name.
Led by Lieutenant Governor Diane Primavera, the Office of Saving People Money on Healthcare will form the beating heart of our efforts to reduce patient costs for hospital stays, for expenses, to improve the transparency of pricing, allowing for competition, to lower the outrageous cost of prescription drugs, and to make insurance more affordable and achievable.
A lot of people like those goals, but how do you do it? So, well, the words today are a step toward keeping one of Polis' promises. We likely won't have a final grade on this one for years. The office that he created will not have the power to unilaterally reduce costs. It will make recommendations to the legislature on what it could do to reduce costs by law. So why exactly do we need a new government office to make recommendations to another branch of government? Our Marshall Zellinger got some differing answers.
I came into this world with a rare genetic disease that causes episodes of mass swelling ranging from simply painful to fully life-threatening.
Rachel Wall was born to be part of the governor's healthcare news conference.
I take 6 pills in a day and use my inhalers twice.
She took us to her home to show us the prescription medicine she needs to survive.
I usually end up spending $1,500 to $2,000 on medication.
There's a lot of departments across state government that handle health care, but there's been no office until today dedicated to helping us save money on health care.
Surrounded by more people than probably should have been in the governor's office at once, Governor Jared Polis signed an executive order establishing his Office of Saving People Money on Health Care. Not in the room, any Republican lawmakers.
I don't know how we feel about creating a new office when we could just have a conversation and probably, in fact, agree on a lot of things.
Republican House Minority Leader Patrick Neville told me he didn't even know about the announcement until we told him.
The little brief discussions I have had with the governor, it doesn't seem like he's pushing universal or single payer, but he actually does want to lower the prices. And if we can do that, that's something that we'll help out with.
I would be interested to watch the lobbying costs of pharma and of the Hospital Association, because I believe they're going to start lobbying up.
Democratic House Majority Leader Alec Garnett also revealed something he hopes this new office can do that President Obama's Affordable Care Act did not.
It should have been called the Increased Coverage Act, because what it really did is that it increased coverage across the state. What it didn't do was reduce costs.
So if you're trying to reduce costs for consumers, which Kyle and I were just talking about, who pays more? So far, everyone I've talked with says no new taxes, no shifting the cost to any other consumer. So probably hospitals. You heard Republican Minority Leader Patrick Neville say the governor doesn't seem to be pushing universal health care. Well, tonight, Kyle, in a committee room at the Capitol, a bill is being discussed to create a state-backed health coverage. It's not required, not covering everyone, but seems to be a baby step toward universal health care.
So the hospitals are going to pay. I wonder where they get their money. I don't know, we should look into that as well. All right, Marshall, thank you.
Subscribe to the next YouTube channel and I'll buy you a beer. Am I actually buying them a beer? This could be a very poor idea. We need some terms and conditions. Offer subject to terms and conditions.